It's Cheyenne and welcome back to my channel. Today we're going to talk about dental assistants' worst fears, okay? What we see in our nightmares, what just makes our day just terrible. And something happened the other day and I was like, oh my gosh, I have to film a video about this stuff because there's just some things as dental assistants that if you're a dental assistant, you can totally relate to it. Or even a hygienist or whatnot, but so we're just gonna go off of the 10 things that just are our worst nightmares. All right, number one is what I experienced the other day, and that is a monster tongue, okay? A monster tongue. And if you don't know what I'm talking about a person that comes in for something and their tongue is very large. It's very wide, it's in charge, and it's in my way, okay? And I'm about breaking my hand by using my suction to move it out of the way. So my doctor and I were doing a crown prep the other day, and we're actually doing two on 30 and 31. Oh, and this poor lady, she sat down and I knew right away it was going to be trouble because she sat down and I had to do my impression to make my temporaries out of it. And she opens and the tongue just expands all the way across and it covers all of her lower teeth. And she even had a very small mouth and I was like, oh my gosh, this is going to be fun. I'm so thankful that it was on 30 and 31 because if it was the lower left, and it would have been terrible. But luckily I was able to keep her tongue to the side, and I always feel bad because I really feel like I'm yanking on their tongue. And this lady was a champ because I was pulling that tongue away from those two teeth so he could prep those teeth. And she was a champ. But yes, number one, monster tongues. Ugh, drive me crazy. Number two, people who, when they come to the dental office, their saliva becomes toxic. They can't swallow. They're drooling all over the place. They think their saliva all of a sudden tastes disgusting. And I'm constantly having to give them suction and everything else. Like, just swallow your saliva, guys. You do it all day. I just did it. Like, swallow your saliva. Especially during crown preps. Like when we're taking impressions and stuff, people are drooling all over themselves and I'm just like, why aren't you swallowing? Like, just swallow that saliva. And I go to take out the impression, it's like a pool. It's just like, it's terrible, terrible. Toxic saliva, toxic saliva. Number three, now this is something some people can't control. Some people come in the dental office and I get it, they have back problems, you know, they have neck problems. But my thing is when people come in and they're really rude about it, but they tell us that they can't be leaned back. And I'm not talking about people that have like severe medical problems, like in wheelchairs, stuff like that, like totally accommodating. I totally understand. But people that just act like when you lean them back, like it's the end of the world. And I'm always thinking like, how do you sleep? Do you sleep in a position like this? Like everyone lays back when they go to sleep. I'm talking about people that we lean them back and they're like, they freak out on you. So yes, let us lay you back if we can. I get it if you have a medical problem, but it's really hard to work in somebody's mouth if I can't lean you back, you know? I have to lean you back. I'm sorry, but I do. Number four, people that just don't want to listen. One of my biggest pet peeves is, especially after extractions, and there's some people that just, you know, get under your skin a little bit more than others. But there's this guy that comes into my office quite a bit, and I feel bad for him because he's young, he has lots of decay, but he only comes in when those teeth have reached a level that they need to be extracted. And he comes in late all the time. He clearly doesn't really have any respect for our time, but he comes in and he demands us to do extractions because he's in pain, which, all right, we do. But every time after his extractions, I give him his, you know, post-surgical instructions. I tell him no smoking because he's a heavy, heavy smoker. You know, in ways to avoid a dry socket, okay? So no suction in the mouth, you know, the typical things that you tell patients after they get an extraction done. And this guy, every time, will go outside and smoke a cigarette while he's waiting for his ride. After an extraction, will pull out his bloody gauze and sit there and smoke a cigarette while waiting for his ride. And my window to my operatory is right there, so I can see him just smoking his cig away. And I just want to go out there and be like, what did I just tell you? Do not smoke a cigarette, okay? And every time the following week he comes in because he has a dry socket. And every time I say, well, did you smoke? And he says, no, didn't smoke. Nope. You didn't smoke, huh? Yeah. He's done this to me 3 times now. So the next time he comes in, I'm gonna be like, look, listen here, buddy. I saw you smoke a cigarette, all right? I try to be nice to patients, but next time, no. I'm telling him, I seen you. Or I'm gonna knock on the window and be like, hey, I see you. I see you smoking, okay? Number 5 is late patients, all right? I can't, if you arrive late, just come right in, okay? Don't go to the bathroom. Don't go brush your teeth. Just come. You're already late. We have a certain time frame for you, and I need you to be on time because I only have 60 minutes to get whatever done that we're supposed to get done. All right, so don't go to the bathroom. Don't brush your teeth. That drives me nuts. Also, people that come in for appointments and then the doctor will get them numb and then they'll go into the bathroom for like 15 minutes, 20 minutes. And I'm just like, what are you doing in there? Get out. We've got stuff to do. Get out of the bathroom, okay? Number 6, which again, I understand some people cannot control this, but when you show up for an appointment, do not bring your infant or your little kid or your whole family. Like, we're trying to get stuff done here, and if your infant's good and I guess it's sleeping, then that's fine. Preferably, probably should get a babysitter, but I can't be holding your baby during your dental appointments. I don't know if you guys have ever had to do this, but I've literally had to hold somebody's infant because they were crying while they got a cleaning done. And I can't be responsible for people's kids. And I can't have them running around the operatory. We have lots of sharp objects. We have dirty stuff. We have a lot of things going on. So yes, please don't bring your kids to dental appointments. I don't know. I even know some offices that don't even allow children or extra people back there, but my office is pretty nice about it. But sometimes it's like, please don't bring your children. Like, just have a family member, or, you know, do it when you have someone there available to watch them, because it's just not a place for children. It's just really not a place for children. The next one is the mouth breathers, okay? And now, some people come in and they have a stuffy nose, which, again, I don't want your germs. Like, if you're sick, stay home. But if you have allergies or whatever, I get it. But you have to breathe through your nose. Do you know how hard it is to suction saliva out of somebody's throat when they're refusing to breathe through their nose and they're breathing through their mouth like, and there's liquid back there and it's just like a fountain. It's like, and I'm trying to suction constantly while handing my dentist stuff, while keeping my stuff organized. Mouth breathers. Like, breathe through your nose. That's all I ask. Just breathe through your nose. Please breathe through your nose. And then we have the needy patients. And if you work in dentistry, you know what I'm talking about. The patients that, it's cold in here. Do you have a blanket? Oh, do you have a towel for the back of my head? Can I get a cup of water? Can I get a magazine? I need to go to the restroom. Oh, I'm late, but I'm gonna brush my teeth. I'm gonna go brush my teeth real quick. Real quick. I literally had this patient that I've never been asked this before ever, and it was so weird. But, you know, she's in for a filling, so I brought her into the chair. Right away, super needy. She needed me to raise the chair and recline it back a little bit so she can get into it, which she wasn't like an older patient, probably was in her 30s. But whatever, I did it. She got into the chair, asked for a towel immediately for the back of her head because she didn't like putting her head back onto the chair. And then told me how cold it was, so I had to get her a blanket. And And then I'm like, okay, well, you know, he got her numb, and then we're gonna leave for a few minutes and come back once the anesthetic had sit for a little bit. And then she stops me while I'm leaving the room, which my dentist escaped, good for him, but I didn't. And she's like, can you keep me company? And she looks back at my tray that I have set up for the filling, and she's like, can you explain to me what all these instruments do? You know, just so there's something to do, just tell me what all these instruments do and how you're gonna use them. I was like, you know how much I have to go do, Karen? I don't have time to sit here and explain my whole setup to you. I've got sterile, I have a room that's dirty next door, I have a chart note I need to go complete, I have a call that I need to go do, like, I got time for this. You know what? I had to go in the room and explain every little instrument and how it worked and what we were gonna do so I could keep her company. And it's not like she was nervous, she's just a needy patient. A needy patient. A needy patient. And some people might watch this video and be like, wow, girl, you're an asshole. And you know what? If you've worked in dentistry for as long as I have, okay, you get to a point where like, you know these type of patients and you know the frustration that comes with these type of patients. You get it. You see me. You see what I'm talking about. Also, we have the last minute patients, which drive me crazy as well. These are patients that come in for their cleaning and exam, and the doctor treatment plans many of fillings and tells them they have decay that they need to get done, and then they cancel or no-show to their appointments, and then it's just a following thing. They always come for their cleanings, but not for their treatment. Until one day they decide to come in on a Friday at 3:30 and just walk into the office and say, this tooth's really bothering me, I need to get this filling done. But it's actually been 3 years since that filling's been diagnosed, so now it's actually a root canal or an extraction, and they demand that it get done right there at Friday at 3 o'clock. Like, get this done today. Because I'm in a lot of pain. And it's like, you know what, Karen, we diagnosed this 3 years ago. 3 years ago you were here and we told you that tooth needed a filling. 3 years ago. You've had 3 years, Karen, to get this done. But yes, Friday at 3 o'clock, we will get this done for you. Was that 10 things? I feel like when I do these videos, I'm always like, was that 10 things? I don't know. But yes, those are some of a dental assistant's worst nightmare. Worst nightmare. Also the flinchers, you know, you get in there and they're like flinching all over the place. The cell phone users, which, gosh, that drives me nuts too. You're working on them and they're holding their phone like this and they're just like, trying to text people. And they probably feel like they're not moving, but they are moving. And you're just like, can you not text right now? Like, trying to do a filling here. Trying to suction. Also, the people that expect you to get 100% of the saliva and water out of their mouths. And they are very vocal about it and try to make you feel like you're terrible at your job. It's like they have like a little bit of liquid in the back of their throat and they're like telling the doctor to stop and they're like, suction, suction, suction more. And you're like, really? Like, you have a very little bit of water back there. I think you're gonna be okay. Yeah. All right, I just had to get this stuff off my chest. So I hope if you were a dental assistant or if you've been in the dental field that you appreciate this video and you understand where I'm coming from. And if you don't, then if you're not in the dentistry field, if I watch this video, you're like, wow, this girl needs to calm down. But if you are, you understand my frustration. But anyways, I hope you guys enjoyed this video and I'll see you in the next one. Bye, guys.